So, have you ever thought about whether offering mammograms actually reduces breast cancer deaths?
Yeah,
It's a pretty important question.
definitely. What's the latest research saying?
Well, there was this study where they offered mammography to one group, call it the treatment group, and they had 39 deaths.
Okay,
The control group, which didn't get mammograms, had 63 deaths.
that's a noticeable difference, but is it statistically significant?
Exactly. That's where hypothesis testing comes in.
Right?
We need to figure out if this difference could have happened by chance.
So how do we determine that?
We start by creating a control model.
Mm-hmm.
Basically, we assume each person has the same probability of dying from breast cancer, like 0.002.
So that's like setting a baseline expectation?
Yes, with 31,000 people in the control group, we'd expect around 63 deaths.
Got it.
Then we calculate the probability of seeing 39 or fewer deaths under this control model.
Right.
That's known as the p-value.
And what was the p-value in this case?
It was 0.02. That's really low.
Wow. So that means it's highly unlikely the difference was due to chance?
Exactly. So we reject the null hypothesis that there's no effect.
Makes sense. But wait, aren't there other factors that could influence the results?
Well, yes, but in a well-designed study, we aim to control for those.
Right.
Randomization helps ensure the groups are comparable.
But if the groups aren't truly comparable, couldn't that skew the findings?
You're absolutely correct. That's why proper data collection is crucial.
Agreed.
But assuming all else is equal, the low p-value suggests the treatment made a significant difference.
Indeed. Can this method be applied to other fields?
Definitely. In advertising, for example, we might test whether a new campaign increases sales enough to matter.
By comparing sales before and after the campaign?
Exactly. We calculate the p-value to see if the increase could have occurred by chance.
Mm-hmm. But we have to account for other variables like market trends, right?
Absolutely. It's like trying to see if a new fertilizer works without considering the weather. You need to control other factors.
Makes sense. So hypothesis testing gives us a framework to make informed decisions.
Yes, but we need to interpret the p-value correctly.
How so?
Well, a low p-value means the result is unlikely under the null hypothesis, but it doesn't measure the size of the effect.
So we should consider practical significance too?
Exactly. An effect might be statistically significant but not meaningful in real life.
Right. Got it. So we need both statistical and practical perspectives.
Absolutely. It's all about seeing the bigger picture.
Yeah.
In fields like healthcare, getting this right is literally a matter of life and death.
Totally. And in other industries, it helps us make smarter choices.
Couldn't have said it better myself.
Mm-hmm.